Hi, I'm Dr. Stephen Pratt. I'm an anesthesiologist, and I'm the medical director of the Pre-Admission Testing Center here at Beth Israel Deaconess Medical Center. Having surgery is understandably a scary process for most people. Fear of the unknown can make that worse. The more information we can give, we find the calmer patients are going to be. Every patient who comes through PAT first gets a phone call from one of our nurses. It gets a very thorough medical history. It identifies if they have any special conditions that we really need to be concerned about. They also give the patients a fair amount of information, when they should stop eating, what pills they might take. About a third of our patients we ask to actually come to a pre-admission testing center to get a more in-depth history than we can get on the telephone. We have 3 goals during this visit. The first is to make sure that the patient really knows what to expect on the day of their procedure. The second goal is to make sure that the anesthesia team knows the medical history in as much detail as we can. And so we really try to get an in-depth history of all the patient's medications, their past medical history, their past surgical experiences. And then the third goal is to identify if there are any health concerns that we need to get fixed before the patient actually goes to surgery. Some patients have heart conditions that haven't been seen by a cardiologist for several years. We may ask that they go back to their cardiologist to make sure that their heart is in the best condition they can be in. There are several things that a patient can do to help make sure that their visit to pre-admission testing goes as well as possible. The first is to know their medical history. The second is to know all of the medications that they take. That includes over-the-counter medications. They can come prepared knowing who their doctors are and what the contact information for each of those physicians might be. One of the really important points that we try to emphasize here in PAT is that the patient will meet their actual anesthesia team on the morning of surgery. That team will have reviewed the medical history that we have obtained here in PAT, and they'll really be prepared to take care of that patient having that surgery on that day. The patient really has a chance to finalize any concerns they may have had. They forgot to ask questions in PAT. That is really the end of that pre-admission journey. The ultimate goal really centers on the patient. We try to make it as efficient as possible. Most patients can be in and out in under an hour. And we really work to try to make patients feel as comfortable as they can, because we know that this is all about the surgical experience for the individual patient, the individual human coming here to Beth Israel Deaconess Medical Center.